Okay, hello student. So before going to start the session, we go through some technical check. Please answer me, is my voice clear or not and screen visible or not? A student who joined from the YouTube live, they can answer in the chat box of YouTube. Okay, is my voice clear or not and screen visible or not? I think my voice is clear, screen is visible, so we want to start the session. So up to the last session, we already discussed about the contraceptive method, one contraceptive method, that is the natural contraceptive method. From today's session, we are going to discuss about the barrier method. After that, we are going to discuss about chemical method, and next one is the permanent method. And after that, we are going to discuss about MTP, medical termination of pregnancy, and after the medical termination of pregnancy, we are going to discuss about the you can say STD, okay, sexually transmitted disease. Okay, so this part we will going to discuss in today's session. So uh, be in the class properly. Okay, so let's start with some questions, and question on your screen. Family planning program started in 1947, 1951, 1965, 2001. And I'm launching poll for it, guys. Please answer fast. Student who join from the YouTube live, they can answer in the chat box of YouTube. You have a 60 seconds to solve this question. Please everyone try to answer and be attentive in the class. Please answer fast, guys. We already discussed this thing in the last session. Okay, you have a 10-second only. Please answer fast. Okay, so I'm in this poll and this is your result. Here maximum people choose an option B. Obviously option B is the correct option. That is the 1951 is the year. From this year, Indian government start family planning program. So India is the first country in the world who start the family planning program. Okay, so going forward, next question, RCH not included. RCH के अंडर क्या चीज नहीं आती है? Option A is the awareness about the reproduction, sex education, sex determination, knowledge of pregnancy. I think you already know about the RCH, that is the reproductive and child health. So RCH started under the family planning program. Okay, so I'm launching poll for it, guys. Please answer fast. Student who attend from the YouTube live, they can answer in the live chat. No one answer the question who attend from the YouTube. Please be attentive in the class, guys. Don't worry, अगर गलत भी हो जाए तो ठीक है. But try to answer. ठीक है, try to guess, try to answer. ठीक है. It develop the habit. Okay, okay, you have a 20 seconds remain to answer this question. Okay, guys. So I end the poll, and this is your answer here. 50% people choose an option C, 50% option choose an option D, but the correct option is the option C, that is the sex determination. So RCH not included the sex determination. Actually, sex determination is the crime in India. Okay, so any other government scheme also not, we can say, tell about the sex determination. Okay, so other points are correct. RCH, in RCH, awareness about reproduction is included, sex education included, knowledge of pregnancy also included. So let's start with barrier method. So we already discussed the natural method in the last lecture. So today we are going to discuss about the barrier method and other method like chemical method. Okay, so what is meant by barrier method? So when we talk about the barrier method, uh, we develop some barrier between the sperm cell and egg cell. Okay, and it avoid to mating sperm cell as well as egg cell. Okay, or we avoid the fertilization process. Okay, with the help of barrier method. And barrier method have a two part. First is the mechanical means, and the next one is the chemical means. Then what is meant by mechanical mean, and what is the difference between mechanical and chemical? In case of chemical means, we use the some type of chemicals. Okay, we in the sense persons use, okay, human use, okay, some type of chemical which important for the avoiding fertilization as well as it immobilize the sperm, or we can say it avoid the locomotion of the sperm. Okay, lashing movement of sperm को वो रोकेगा. I think you already know about the lashing movement of the tail of the sperm cell. ठीक है. So this is the chemical method. Mechanical methods separate the sperm and ovum by the physical wall. Okay. So let's start with the mechanical means first. Actually, whenever we talk about the mechanical means or chemical means, both for the male and female. Okay, दोनों के लिए रहेगा, मेल और फीमेल के लिए. So whenever we talk about the mechanical means, in case of male, male have a condoms. ठीक है, मेल के लिए condoms है. ठीक है, and it made from the latex rubber and it cover on the erected penis. Okay, and it prevent the STDs like sexual transmitted disease, HIV/AIDS, gonorrhea, syphilis. Okay, this is a different type of disease prevented by the condoms. Okay, next part is the female. Okay, so for the female there have a different type of devices like diaphragm also known as the female condom. ठीक है, इसको हम female condom भी कहते हैं. ठीक है, next one is the cervical cap, waltz. Okay, okay, and sorry, diaphragm not a female condom. Female condom is a different part. So we will discuss about the diaphragm in the next slide. ठीक है, so female condom are the different part. ठीक है, उसको हम बाद में डिस्कस करेंगे. इसको मैंने थोड़ा गलती से बता दिया. ठीक है, चलो 1 minute. Okay, so next part you can see this is the condom for the male and this is the condom for the female. Okay, so this is the female condom. Actually, male condom is very effective for to avoid the fertilization process as well as is important to avoid STD. Okay, fertilization. Okay, and it is the user friendly. ठीक है, ये यूजर फ्रेंडली भी है. इट इज द कॉस्ट इफेक्टिव. ठीक है, ये कॉस्ट इफेक्टिव भी है एंड इट इजीली अवेलेबल. ओके, इट इजीली अवेलेबल. ठीक है, so this is the importance of male condom as compared to female condom, because female condom not easily available. Okay, so in case of female condom, you can see the two types of ring. This is the big ring and this is the small ring. Okay, so small ring inserted toward the vagina, inserted inside the vagina, and this this is the outer ring. Actually, large ring is the outer ring और ये बाहर की तरफ रहेगा. ठीक है, and female condom wear before the sexual activity. Male condom also wear the before sexual activity. ठीक है, after the use of condom इसको जो है dispose किया जाता है. ठीक है, so next thing is the diaphragm. So diaphragm is the plastic or rubber, it made from the rubber or plastic, and it cover the cervix. So you can see this is the cervical region, okay, and it cover by the diaphragm. So you can see how to apply, how to use diaphragm. Actually diaphragm not a user friendly, ठीक है, ये उतना यूजर फ्रेंडली नहीं है एज कंपेयर टू condoms, ठीक है, नॉट यूजर फ्रेंडली, ओके, बिकॉज when it want to apply, इसको insert करना पड़ता है from the vagina and it cover, you can see in this picture, okay, so it cover the female cervical region, okay, so that's why ये थोड़ा सा यूजफुल नहीं रहेगा इस्तेमाल करने के लिए या यूज करने के लिए. यू कैन सी इन दिस पिक्चर ऑल्सो, यहाँ पर आप देख सकते हो, ठीक है. सो नेक्स्ट थिंग इज द सर्विकल कैप. So cervical cap is the modified version of the diaphragm. Okay, so here you can see the one of extension in the cervical cap. Cervical cap भी उसी तरीके से काम करेगा, but you can see the one of the extension, and this extension inserted in the cervix region. यहाँ पर cervix region में इस extension को insert किया जाता है, and with the help of this extension, this cervical cap not we can say replaced by द स्पेसिफिक रीजन, ठीक है, तो ये यहां से रिप्लेस नहीं हो सकता, ठीक है, ये डिस्टरबेंस को जो है मैनेज कर लेता है विद द हेल्प ऑफ दिस एक्सटेंशन. ओके, सो सर्विकल कैप डायफ्रागम आर द सेम थिंग, एक ही तरीके से है, बट सर्विकल कैप हैव सम टाइप ऑफ मॉडिफिकेशन, ठीक है, बट अगेन इट नॉट यूजर फ्रेंडली, ठीक है, बिकॉज इट वांट टू इंसर्ट इनसाइड फ्रॉम द वजाइनल ट्रैक and where on the cervical region, ठीक है, that's one. So next is the chemical method. Whenever we talk about the chemical method, so there have a one chemical or medicine or we can say drug, that name is the nanoxynol 9. Please remember this name, ठीक है. So nanoxynol 9 is a spermicide, ठीक है, ये क्या है, एक स्पर्मिसाइड है. ओके, सो स्पर्मिसाइड क्या करेगा, इट किल द स्पर्म, ठीक है, ये क्या करता है, किल द स्पर्म, ओके, और इट इमोबलाइज द स्पर्म, ठीक है. इमोबलाइज स्पर्म का मतलब क्या होगा कि यू ऑलरेडी नो अबाउट द लैशिंग मूवमेंट ऑफ द स्पर्म सेल, उसको ये क्या करेगा, इमोबलाइज करेगा, ठीक है. द स्पर्मिसाइड अवॉइड द लोकोमोशन ऑफ द स्पर्म, लोकोमोशन जो स्पर्म उसको रोक देगा, ठीक है. सो दिस ड्रग कम इन अ डिफरेंट फॉर्म इन द मार्केट, ठीक है, अलग अलग फॉर्म में हमें ये ड्रग देखने को मिलेगा, ठीक है. अब ये ड्रग जो है वो अलग अलग कौन कौन से फॉर्म में देखने को मिलेगा, लाइक फोम बेस टैबलेट, ठीक है, सो आई एम राइट हियर foam based tablets. Okay, then what is meant by foam based tablet, there have some type of tablet you can see in this picture, okay, and this tablet inserted before the sexual activity and it developed some type of foam inside the female vaginal tract, okay, and that foam immobilized the sperm activity. Next is the cream base, okay, so it look like just antiseptic cream, ठीक है, इसको भी अप्लाई किया जाता है इनसाइड दी वजाइना बिफोर द सेक्सुअल एक्टिविटी. नेक्स्ट थिंग इज द जेल लाइक क्रीम, ओके, जेली लाइक क्रीम, ओके, सो दिस इज द यूज ऑफ नैनोक्सिनोल 9, ठीक है, इन द केमिकल मेथड, ठीक है. सो नेक्स्ट मेथड इज द डाउचिंग. देन व्हाट इज मीन बाय डाउचिंग, सो यू कैन सी वन ऑफ डिवाइस हियर, सो दिस डिवाइस इज नोन एज द डाउच, ठीक है, इसे हम कहते हैं डाउच. So डाउचिंग मेथड यूज आफ्टर द सेक्सुअल एक्टिविटी, ठीक है, इसको कब यूज किया जाएगा, सेक्सुअल एक्टिविटी के बाद में. देन हाउ इट यूज, ठीक है, कैसे यूज किया जाता है. सो इन केस ऑफ डाउचिंग, फीमेल यूज सम टाइप ऑफ स्पर्मिसाइड क्रीम, ठीक है, स्पर्मिसाइड क्रीम प्लस लुक वार्म वाटर, लुक warm water, ठीक है, and it fill in the douch, ठीक है, डाउच में इसको फील करना पड़ता है, and after sexual activity इट एडेड इनसाइड द वजाइनल, सॉरी इट एडेड इनसाइड द वजाइना, ठीक है, वो भी जो कुछ भी वाटर रहेगा वो इनसाइड द वजाइना ऐड किया जाएगा, एंड दैट्स व्हाई इट क्लीन द वजाइनल ट्रैक, ठीक है, ये क्या करेगा, वजाइनल ट्रैक को क्या करेगा, क्लीन करेगा, ठीक है, दैट अवॉइड द मोबिलाइजेशन ऑफ स्पर्म एज वेल एज वो पूरा जो पार्ट रहेगा उसको क्लीन कर देगा। एक्चुअली डाउचिंग प्रोसेस आल्सो यूजफुल इन द डिफरेंट टाइप ऑफ इंफेक्शन लाइक यूटीआई, ठीक है, यूरिनरी ट्रैक इन्फेक्शन है, ठीक है, इसमें भी इसको यूज किया जाता है, ठीक है। सो डाउचिंग प्रोसेस है वो डिफरेंट, वी कैन से इसके यूज हो सकते हैं, ठीक है, नॉट ओनली फॉर द अवॉइडिंग प्रेगनेंसी, ठीक है। नेक्स्ट पार्ट इज द ओरल कॉन्ट्रासेप्टिव पिल्स। इज इट क्लियर इन योर माइंड, यहां तक क्लियर है सभी को, बताइए, प्लीज गिव मी रिस्पॉन्स। People who attend from the YouTube live, they can respond in the chat box of YouTube. Clear है यहाँ तक? Right? Clear, sir? Or you can give me any type of sign, thumbs up sign, etc, etc. कोई भी साइन बता सकते हो मुझे, ठीक है। Is it clear? Is it clear? ठीक है, चलो, आई थिंक सभी को क्लियर है, ऐसा मैं मान के चलता हूं। Okay. So next part you can see here, that is the oral contraceptive pill. So oral means the pills take by the mouth, ठीक है, माउथ से इन पिल को लिया जाता है बॉडी में, एंड इट एक्ट एज अ कॉन्ट्रासेप्टिव, ठीक है, और ये क्या करेंगी, कॉन्ट्रासेप्टिव तरीके से यूज होगी। सो देयर हैव डिफरेंट टाइप ऑफ वैरायटीज ऑफ पिल प्रेजेंट इन द मार्केट, टैबलेट्स प्रेजेंट इन द मार्केट लाइक मालायन, मालाडी, सहेली, छाया, अनवांटेड 72, unwanted 21. So these are the different type of oral contraceptive pill. But oral contraceptive pill have a different type of mechanism of action. Like you can see the contraceptive pill contain a hormone. Yes, contraceptive pill contain a hormone. Either it contain estrogen or progesterone. Okay. So there have two type of pill. First is the mini pill and next is the combined pill. Combined pill contain a both type of hormone like estrogen and progesterone, and mini pill contain a single type of hormone. So Saheli is a one type of mini pill because it contain only one type of hormonal receptor. ठीक है, ये एक तरीके के हार्मोनल रिसेप्टर को कंटेन करता है। ओके, एंड सहेली मेड बाय द वन ऑफ ऑर्गेनाइजेशन CSIR CDRI, ठीक है। Then what is meant by CDRI? So this is the organization. The organization name is the CDRI. Please remember the name CDRI. ठीक है. So CDRI means Central Drug Research Institute. So I am right here. Central Drug Research Institute, Lucknow. Okay, and CSIR means Central Scientific and Industrial Research. Okay, so CSIR is the parent company or parent organization, and CDRI उसका progeny है, ठीक है। So please remember the name, and it made the Saheli. Saheli is the first non-steroidal drug. Non-steroidal drug. Then what is the meaning of non-steroidal? So I think you already know. Steroid is the derivative of fatty acids. Okay, and it used to making hormonal pill. ठीक है, hormonal pill में इसका use होता है. But steroid is the dangerous for the human body. So that's why CDRI developed the Saheli. So when we talk about the mechanism of Saheli, Saheli actually take during, or we can say up to 3 months, 2 tablets in a week. Okay, 2 tablet in a week. After the 3 month, इसको लिया जाता है 1 tablet in a week. Okay, so this is for Saheli. But whenever we talk about the 21-day pill, so there have a one pill present in the market still, that is the unwanted 21. Okay, so this unwanted 21 made from the both hormone like progesterone and estrogen. Okay, and it take up to 21 days. Okay, it take up to 21 days, and there have no pill up to 7 days. So how it act? ये कैसे act होता है? So you can see in this diagram, you can see the uterine cycle, and you can see on the 14th day what happen? Ovulation happen. Okay, this is the normal uterine cycle. But if any female taking the pill, then what happen inside the female body? So you can see the hormonal level up to 21 day is up. Both hormones are up. Okay, and that's why it avoid ovulation. Okay, it avoid ovulation. So I am right here. It avoid ovulation, and that's why egg cell not release, and that's why fertilization not happen. So this is for the 21 days pill. Okay, like a unwanted 21. Okay, but when we talk about the Saheli, when we talk about the Chaya, it take only one time in a week. एक ही समय में लिया जाता है, एक वीक में आफ्टर द 3 month. ठीक है, अप टू 3 month 2 times इसको लिया जाएगा. ठीक है, सो व्हाट डू दिस पिल? ये पिल क्या करती है एक्चुअली? इट इनहिबिट ओवुलेशन. ठीक है, ये ओवुलेशन को रोकेंगी. इट इनहिबिट द मोटिलिटी सिक्रेटरी एक्टिविटी ऑफ फॉलिपियन ट्यूब. ठीक है, मोटिलिटी सिक्रेटरी एक्टिविटी को रोकेगी. नेक्स्ट, इसके कुछ साइड इफेक्ट हो सकते हैं, लाइक इरेगुलर पीरियड, मूड स्विंग, हेड एक्ट. ठीक है, इन द फीमेल. ठीक है, सो दिस इज ऑल अबाउट द oral contraceptive pill. Next pill is the emergency contraceptive pill. So in case of emergency contraceptive pill, there have a next hormone, that is the levonorgestrel. So levonorgestrel is the synthetic hormone which look like a progestin. ठीक है, so progestin is the female hormone, and ये जो है levonorgestrel, it is the man-made hormone. ठीक है, or we can say synthetic hormone. So it used in the emergency contraceptive pill. There have a one name in the market, that is the unwanted 72 or I pill. Okay, so I pill or unwanted 72, both are the brand name. Okay, which contain the levonorgestrel drug. Okay, so this tablet taken by the female after the failure of contraception. मतलब sexual activity हो रहा है and उस बीच में contraception का use नहीं हो रहा है. At that time, up to the 72 hour after the sexual activity, ये pill को लिया जाता है. That is the emergency contraceptive pill. But again, it's an emergency contraceptive pill. They have a lot of we can say amount of levonorgestrel, and that is the dangerous for the health. ठीक है, dangerous for the female health. Okay, that's why it is the emergency contraceptive pill, not a regular contraceptive pill. ये कोई regular contraceptive pill नहीं है. Okay, so what to do by these tablets? What to do by this tablet? So it we can say avoid the ovulation. Okay, or fertilization. ठीक है, ये क्या करेगा? Avoid ovulation, and it may avoid fertilization. ठीक है, ये क्या करेगा? ओवुलेशन को रोकेगा. अगर ओवुलेशन को नहीं रोक पाया तो फर्टिलाइजेशन को रोकेगा. ठीक है, सो दिस इज द इंपॉर्टेंस ऑफ इमरजेंसी कॉन्ट्रासेप्टिव पिल. इज इट क्लियर इन योर माइंड? इफ इट क्लियर, प्लीज गिव मी सम साइन, गिव मी थम्स अप. चलो जल्दी जल्दी बताओ मुझे. ओके, आई थिंक क्लियर है. सो नेक्स्ट पोर्शन, 1 minute. is the IUDs. So what is the meaning of IUD? IUD is nothing but the intrauterine devices. So you can see the intrauterine, that means it added inside the uterus. ठीक है, इसको कहां पर यूज किया जाता है, ऐड किया जाता है यूटेरस में. So these are the intrauterine contraceptive devices. These devices kept in the uterus. It can't prevent STD. ये STD को prevent नहीं करते. There have three type of IUDs. First is the non-medicated IUD. That means they not use the any type of medicine. ठीक है. Second is the CU releasing IUDs. That means it made from the CU. CU means copper. Okay. And CU releasing IUDs have the examples are CUT, CU7, multi-load 375. Please remember the example because it asks in the examination. Okay. And the third is the hormone releasing IUD. That means it contains some type of hormone, some type of chemicals on it. Okay. And the example are progestasert and LNG20. Actually, this is a 20, not a 0. Okay, so these are the different type of IUDs. So what is the mechanism behind IUD? So whenever we talk about the non-medicated IUDs, you can see in this picture, this is the non-medicated IUDs. So non-medicated IUD develop some WBC. Okay, WBC means white blood cell. Okay, which important for the phagocytotic activity. Okay, phagocytotic activity. Okay, so this is the Lippel loop. Actually, Lippel loop is the old school method. Old school method in the sense it used by the old people. It used in 1962 to 1980 in the US. ठीक है, US में इसको यूज किया जाता था 1962 1980s में. In today's time, it not use anymore. किसी भी तरीके से इसको यूज नहीं किया जाता. So Lippel loop made from the plastic, okay, and it not contain any type of metal, it not contain any type of drug. Actually, it develop it fix on the uterine region, okay, and it develop the phagocytic cell, okay, and that phagocytic cell kill sperm cells. ठीक है, ये क्या करती थी, sperm cell को kill करती थी. ठीक है, so this is the mechanism behind the non-medicated. So it we can say impregnated with the BaSO4. So BaSO4 is the X-ray indicator. ठीक है, ये क्या है, X-ray indicator है. Actually, this Lippel loop made from the plastic, and that's why if due to some issues or due to some problem, what happened? This Lippel loop, we can say, change their place from the uterine region, and that's why there have a lot of effort to take by the doctor to, we can say, find this Lippel loop, and that's why they added some BaSO4 that is an X-ray indicator. So X-ray indicator easily indicate the position of Lippel loop. Okay, that's why. So you can see the next part, that is the CU releasing. So obviously it made from the CU, that means copper, and copper have a natural phagocytotic activity. Copper के पास naturally phagocytotic activity रहती है. ठीक है, that means ये बैक्टीरिया को या किसी सेल को, not only bacteria, other type of cells इसको kill करेगा. So that is the property of Cu metal. Okay, so it suppresses the sperm motility, it reduces the fertilizing ability of sperm. It also coated by the BaSO4 for the in the X-ray. Okay, and you can see the nylon thread here and here also. So what for this nylon thread? So nylon thread important for the insertion of these devices inside the uterus. ठीक है, इंसर्शन एंड रिमूवल दोनों भी काम में ये नायलॉन थ्रेड का जो है यूज होता था. ठीक है, जिससे इसको इंसर्ट किया जाता है यूटेरिन रीजन में. ठीक है, नेक्स्ट इट द एग्जांपल्स आर, ये एग्जांपल इंपॉर्टेंट है, दिस इज द इंपॉर्टेंट पार्ट, दैट इज CUT, CU7, मल्टीलोड 375. ठीक है, these are the example. So moving forward, next part is the hormone releasing IUD. So you can see the hormone releasing here. So it releases some type of hormone, and these hormone are useful to unstable the uterus फॉर द इम्प्लांटेशन, ठीक है। सो ये हार्मोन क्या करेंगे, इस यहाँ पर रिलीज होते रहेंगे, इट रिलीज इन द यूटेरिन रीजन एंड इट इम्पोर्टेंट टू अनस्टेबल फॉर द इम्प्लांटेशन, ठीक है। सो इट वाइडली यूज इन इंडिया, ठीक है, and the example is the LNG-20. Okay, so next part is the injection. So some type of injection also take by the female, like some type of hormonal injection, ठीक है, and some type of implant also available in the market, ठीक है। So implant में क्या रहेगा, you can see the plastic tube here. So plastic tube contain the some type of hormone, ठीक है, इसके अंदर कुछ टाइप का हार्मोन रहेगा and it implanted inside the हैंड रीजन, यहाँ पर हाथ के अंदर इसको लगाया जाएगा एंड इट कंटिन्यू रिलीज द स्पेसिफिक हार्मोन व्हिच अवॉइड द प्रेगनेंसी और फर्टिलाइजेशन प्रोसेस, ठीक है। सो इसका टाइम पीरियड क्या रहता था इम्प्लांट का, दैट इज द 3 to 5 ईयर। ओके, सो अप टू दिस पार्ट वी डिस्कस द टेम्पररी मेथड। यहां तक जो हमने डिस्कस किया सारा टेम्पररी मेथड। Next is the permanent method, and in case of permanent method, there have two methods, which is the vasectomy for the male, and the next method is the tubectomy for the female. So what happened in the vasectomy? So we cut the vas difference. That's why the sperm cannot travel. ठीक है, यहाँ से sperm जो है वो travel नहीं हो पाता है. And whenever we talk about the tubectomy, so doctor cut the fallopian tube. That's why egg cell cannot travel for the fertilization process. So these two are the permanent method. ये दोनों भी क्या है, permanent method है. So you have a question on your screen. It's Saheli, a new oral contraceptive developed by All Indian Institute of Medical Science, Central Drug Research Institute. Option C, Healthcare Private Limited. Option D, Bharat Immunological and Biological Corporation Limited. So I launched the poll here. Please answer fast. You have a 60 seconds to solve this question. चलो जल्दी जल्दी। Okay. Okay, so I'm in this poll. And this is your result. Here maximum people choose now option B. Obviously option B is the correct option. ठीक है, so option B यहाँ पर correct option है. So Saheli, a new oral contraceptive developed by the Central Drug Research Institute, Lucknow. Option B is the correct option. ठीक है. So here All Indian Institute of Medical Science, not a organization who doing the research on the drug. Okay, actually All Indian Institute of Medical Science, that is the AIMS, is the organization who develop the hospitals, okay, as well as doing research in the different type of diseases. Okay, next, Healthcare Private Limited is not a company, it's a private company. That's why here you can see the private limited. Again, Bharat Immunological Biological Corporation Limited, again it is the one of private company. Bharat Immunological Biological Corporation developed the Covaxin. ठीक है, so इसने Covaxin को बनाया था. ठीक है, so this is for question. Next discuss करते हैं. You can see the next question on your screen. Which of the following is a hormone releasing intrauterine devices? Multi-load 375, LNG-20, cervical cap, vault. And I am launching poll for you guys. Please answer fast. Do you have a 60 seconds to answer this question? Okay. Okay, guys. So I'm end this poll. And this is your result here. Maximum people, 50% people choose an option A, 50% choose an B. But option B is the correct answer. That is the LNG 20, multi-load 20, sorry, 375 is the copper T. It is the example for copper T. Okay. So what is the meaning of LNG here? LNG means levonorgestrel 20. Okay. Cervical cap vault are not the answers. Okay. Chalo. So moving forward, next part is the MTP. That is the medical termination of pregnancy. In short, we called abortion. ठीक है, हम इसको कहते हैं abortion in our common language. So what is meant by MTP? So MTP is the intentional or voluntary termination of pregnancy before full term. Okay. So in all over world 45 to 50 million MTP happen per year. एक साल में 45 to 50 million MTPs होती है. MTP help to decrease the population. Okay. A lot of countries legalize MTP, but some of countries not completely legalize, and some of countries completely ban the MTP. Ban मतलब पूरी तरीके से बंद है, ठीक है? Due to their religious, ethical, emotional issues, like some of Arab countries, African countries, ठीक है? यहाँ पर MTPs ban है पूरी तरीके से. So government of India legalized MTP in 1971. Please remember the year because year asked in the examination. 1971 में जो है एक बिल निकला पार्लियामेंट में एंड उसको पास किया गया एंड वो था अबॉर्शन के ऊपर, लीगल अबॉर्शन. ओके. सो इन इंडिया देयर हैव सम ऑफ कंडीशंस. ठीक है, यहाँ पूरी तरीके से जो है एमटीपी we can say not legalized in India. ठीक है, there have some we can say conditions. Okay, so you can see the 4 condition in India. If these 4 conditions acquire, then MTPs are legalized. पहला condition क्या है? If fetus detected to have a severe mental or physical disabilities. Okay, मतलब उसमें कुछ physical mental disabilities है. If fetus के अंदर, then it is the legal in India. Okay, उसका permission मिल जाएगा. If it harm to the woman, okay, मतलब जो pregnant lady है उसको अगर harm होता है, then it is the legalized. If pregnancy is the outcome of rape, ठीक है, rape से अगर pregnant रहती है कोई lady, then it is the legalized. And if married woman want to, we can say, abort the pregnancy, then it is the legalized. तभी ये legalized है. So MTP is the safe up to the first trimester. Up to the first trimester का मतलब क्या होता है? First 3 months. ठीक है, first 3 months में ये क्या रहेगा? ठीक रहेगा, safe रहेगा. ठीक है, but second trimester abortion are very risky. ठीक है, अब MTP जो है वो परफॉर्म किए जाते इंडिया के अंदर. इफ वी टॉक अबाउट द इंडिया, देन लॉट ऑफ MTP परफॉर्म इलीगली इन इंडिया and it dangerous for the we can say girl fetus. ठीक है, जो girl child fetus रहेगा उसके लिए ये dangerous रहेगा. So there have one test and the name of test is the amniocentesis test. So this amniocentesis test is nothing but the test of amniotic fluid. Amniotic fluid. ठीक है, and this amniotic fluid contain a genetic material genetic material of fetus. Material of fetus. Okay, guys. So, with the help of amniotic test, doctor or person determine the sex of child or sex of fetus. Actually, amniocentesis test is an important test for to detect abnormality in the pregnancy, like genetic abnormalities in the pregnancy, but it misused by the lot of doctors, okay, for the detection of sex of baby, ठीक है, and उसके बाद में MT को perform किया जाता. So you can see, so Medical Termination of Pregnancy Amendment Act in the 2017, it added by the government, ठीक है, and it reduces illegal abortions. And in this act, there are a lot of, we can say, heavy, क्या बोल सकते, सजा जो है वो डाली गई है, ठीक है, जो illegal abortions करता है उसके लिए, ठीक है. चलो, so according to this act, pregnancy may be terminated within the first 12 week. 12 week means first trimester. ठीक है. So on the opinion of a registered medical practitioner, single medical practitioner, for the first trimester चलेगा, कोई issue नहीं. But if pregnancy is between 12 to 24 weeks, then they want, or we can say rule wants, government want to register medical practitioner because it is the risky, ठीक है. यहाँ पर क्या है, risk है, ठीक है, इस वजह से. So next you can see the amniocentesis test. So you can see this is the fetus, and you can see this portion is full of amniotic fluid, and amniotic fluid taken by the syringe, okay. यहाँ से syringe से जो है amniotic fluid को लिया जा रहा है, and it determine the different type of genetic abnormality when it test by the researcher, ठीक है. So इससे detection of sex भी होता है, ठीक है. So next question on your screen is the permissible use of technique of amniocentesis is for detecting. You can see the question here, permissible use. They ask the permissible use, detecting sex of unborn fetus. Option B, artificial insemination. Option C, transfer of embryo into uterus of the surrogate mother. Option D, detecting any genetic abnormality. I'm launching poll for you guys. Please answer fast. चलो आंसर करो फटाफट. You have a 60 seconds for it. Okay. Only 30 seconds are left, guys. Please answer fast. Okay, I am in this poll, and this is your result. Here maximum people choose an option D. Obviously option D is the correct option, ठीक है. So permissible use is the detecting any genetic abnormality, ठीक है. Other options are the wrong option. So next thing is the sexually transmitted disease. Sexually transmitted disease, also known as the STI or STD. Okay, so you can see, so why it called STI? STI means infection. So sexually transmitted infection, sexually transmitted disease. It also known as the VD, that is a venereal disease or reproductive tract infections. There are different type of disorder in this section, like gonorrhea, syphilis, genital herpes, chlamydiasis, genital wart, trichomoniasis, hepatitis B, HIV, etc. So you can see the different type of disease on your screen, and you can see here the bacterial disease. So chlamydiasis happen with by the chlamydia trachomatis. So this is the bacteria. These are the bacteria. ठीक है, ये सारे के सारे बैक्टीरिया है. ओके. Next is gonorrhea. Gonorrhea, the causative agent of gonorrhea is a Neisseria gonorrhoeae. This is the bacteria. Syphilis happen by the Treponema pallidum. Treponema pallidum से syphilis होता. So you can see the viral disease. So these are the viruses. Okay. So you can see the HPV, the name of disease. ये disease के name है HPV. So it happened by the human papilloma virus, the causative agent of herpes. Herpes is the name of disease. It happened by the herpes simplex virus. And next is the hepatitis is a disease, and it happened by the hepatitis type A, type B, type C, type D or E. Next is the AIDS, okay, and it happened by the HIV, that is a human immunodeficiency virus. Okay, guys, chalo. So hepatitis B and HIV also transmitted by the sharing of needles, injection, or any type of surgical instrument, as well as it transmitted by the transfusion of blood. Transfusion of blood means एक person का blood दूसरे के body में लगाना. Next is from the infected from the mother to fetus. So here hepatitis B and genital herpes and HIV जो है ये completely curable नहीं है, but other diseases are completely curable. Okay. So what is the symptom of the disease? So symptom क्या रहेगा? Itching, fluid discharge from the reproductive tract. Okay. Slight pain in the reproductive tract, swelling of the reproductive tract in genital region, absence or less significance early symptom, and social stigma deter the infected person. So there have a we can say fear in the mind, or जो patient रहता है उसके mind में fear रहेगा, and that's why they cannot communicate to the other peoples. Okay. So इसके वजह से it increases, symptom increases, and increasing symptom क्या रहेंगे? That is the pelvic inflammatory disease, that is the pain in the pelvis region. ठीक है. Next is abortions happen in the female. Okay. Stillbirth, abortion in the sense miscarriages happen in the female. Next is the stillbirth. Stillbirth is the we can say dead fetus born by the female. ठीक है, मतलब dead fetus का born होगा. Fetus death inside the womb, that is the stillbirth. Okay. Next is the ectopic pregnancy. So ectopic pregnancy का मतलब होता है the implantation not happen on the uterus. Okay. So pregnancy or implantation happen inside the fallopian tube. That is the ectopic pregnancy. Ectopic pregnancy also the dangerous thing. You can see here the ectopic pregnancy here. So you can see the implantation happen inside the fallopian tube. So this is the example of ectopic pregnancy. Next is infertility. Next is cancer of reproductive tract. So this is the different symptoms of the disease. Next, prevention. So what the we can say major takes to prevent this disease? Avoid the sexual activity with unknown partner or multiple partners. Okay. Always use condom during the coitus. Coitus means sexual activity. In case of doubt, go to qualified doctor. Qualified doctor in the sense sexologist or gynecologist. Okay. Do not go toward the जो roadside बैठते हैं, ठीक है, like चमत्कार बाबा वाले, like that, ठीक है, and get complete treatment. This is the preventive measure. Okay. So you have a question on your screen now. Best way to avoid STD is use of condom, take contraceptive pill, use copper T, tubectomy. So I am launching poll for it, guys. Please answer fast. चलो जल्दी जल्दी आंसर करो इसका. You have a 60 seconds to answer this question. Okay. You have a 30 seconds to answer this question. Please answer fast. You have a 10 seconds to answer this question. Please answer fast. Okay, so I'm in this poll and you can see the result. So maximum people, 100% people choose on option A. That is the correct one. So condom is the only contraceptive measure which avoid the STD, जो sexual transmitted disease को रोक सकता है. So this is for today, guys. In next session, we discuss the ART, that is the last portion of this lesson, and then we started most probably principle of inheritance, or we started the molecular basis of inheritance. दोनों में से कोई एक lesson start कर देंगे. Thank you for joining. Thank you for your attention. If you have any type of issue, you can ask me in 2 minutes. If not, then you can leave for a day. ठीक है, चलो कुछ इशू हो तो बता सकते हो. ठीक है, then goodbye to all. Thank you for joining. I think किसी का कोई इशू नहीं दिख रहा है मुझे.